So today we have a case of young adult male patient came with history of recurrent shoulder dislocations. On further inquiry, he said there is a definitive history of anterior dislocation. So what we can see over here in the coronal star images that subcortical cystic changes in the posterior superior aspect of the humeral head, and there is also underlying shallow defect in the cortex, which is known as a Hill-Sachs lesion, which is very common with the anterior dislocations, and we have to give the size in the form of the length and depth of the lesion. Associated with this is generally we get the labral tear, which is known as a Bankart's tear. So here there is a tear of the anterior inferior labrum, which we are seen to be extending superiorly up to the 11 o'clock position. So similar findings we can also check on sagittal images where subcortical cyst, then there is a shallow defect, that is the Hill-Sachs over here, and for the labrum we can see the tear of the labrum which is extending from 7 to 11 o'clock position anteriorly. So this is a case of Hill-Sachs lesion with Bankart's. Generally we give a glenoid tracking in cases where there is a underlying fracture of the glenoid bone or the glenoid bone loss. However, in this case it is not applicable. Thank you.